Yes.
Okay, great, fantastic. Okay, so welcome everyone. Today we're going to be discussing the fourth seminar for us. It's Achieving Birth Spacing and Reproductive Health. How can these help families? Thank you all for attending. We're glad to be here, and like they've already mentioned multiple times, if you have not put your name in the chat box, this is super important because it's the only way that we can confirm that you received your attendance for today. And so please, please, please do not forget to do this. This is what this slide is for. Time to introduce yourself. So go ahead and write your first and last name and where do you want to travel. But if you've already done so, as we discussed earlier, you do not need to. But since we've already kind of done this for a little bit now, I'm just going to move on. So things to need to know. So everyone in this sessions will have the ability to see and hear the presenter, Ms. Arellano. To limit the background noises, everyone will be in listening mode only. So I will be muting everyone besides Ms. Arellano, including myself. And if you need to ask a question, there are multiple reactions that you can go ahead and do. And like we've mentioned, it looks like if you attend all of the sessions or more than 4 of them, you will be placed in the priority list for yoga sessions coming around the month of November, which is pretty cool. And if you attend all 6 sessions, you will be entered for a raffle for $100. And so if you have not already, if you're still on track, then we recommend, yes, of course, $100. That's pretty cool. And so who should be attending? So these are just the people that we believe should be attending. Expectant moms and dads, new moms and dads, parenting partners, health educators, community health workers, grandparents, women of childbearing, anyone interested in overall community health. And we have a mix of everyone here in this in attendance in the audience today. That's great to hear. So if everyone was not aware, this is our birth spacing initiative. That originally began in 2018 to 2019. The original birth spacing number 1 offered educational, outreach, counseling, and referral activities to more than 500 African American and Hispanic women over a 9-month period. And through partnerships with the African American churches, a licensed clinical social worker, door-to-door neighborhood canvassing with communities for new educational funds, we identified women with mental health services, food security, and economic opportunities as a crucial focus for change. So that was the first one. And so now we're in birth spacing number 2, which is a continuation effort. So our goal is to increase birth spacing and reproductive health knowledge and to increase mental health support and resources through a series of virtual educational webinars, like such as the one for today. We are sponsored by March of Dimes, ourselves here at the Western Fresno Family Resource Center, Black and Foot Health, Anthem Blue Cross, and of course, our Fresno Grows Best Baby Zone initiative. So as everyone is probably aware, we have 6 sessions, today being the Achieving Birth Spacing and Reproductive Health, How Can These Help Families, scheduled for November 19th, 2020. And each seminar has been scheduled at 6 p.m. And then our next one is going to be on December 3rd. What is a doula? Benefits of a doula. So all of the sessions are interrelated, so therefore the terminology will be heard throughout the rest of the sessions. So what's an introduction? The introduction for today, we have a presenter named Ms. Arellano, who I'm about to give control to. She is a bilingual health educator with Anthem Blue Cross, and she's a Central Valley native who grew up in a small town of Selma, California. She earned her bachelor's degree in biology and Spanish from Fresno Pacific in 2016, and her master's degree from the University of Southern California in 2019, which, by the way, is where I really want to go to for grad school. So Ms. Arellano, if you could please stay afterwards and tell me how to get in, I'd appreciate that. And then she's had several years of experience in reproductive health and reproductive justice and believes that everyone should have access to unbiased, medically accurate information so that people can make fully informed decisions about their health. So if anyone has any questions, please go ahead and make the chat, but that's just a little brief introduction of our presenter today, Ms. Arellano. So today we're going to be running a pre-test just so everyone can go ahead and test their knowledge of what we're going to be discussing today. Just a little like, what do you know? What do you know? So I'm going to be launching a poll right now, and then everyone can go ahead and respond. Please let me know if you can't see the poll, but the poll is now live. So please go ahead and make a little note in the chat box if you cannot see it. But if you do see it, then please answer the questions, which would be very helpful for us to see where you're at for this session. Just to confirm, everyone can see it, correct? Make a little, maybe unmute.
Yes.
All right, everyone, about 7 out of 9 people. I'm just going to give it about a minute or two for the last 2 people to continue responding. Thank you so much.
I can't hear anything.
Yeah, sorry. We're just waiting for the last 2 people to respond, and no one's really saying anything right now. Okay, about 30 seconds for the last person to respond. We got 8 out of 9. 30 seconds. Okay, I'm going to end the polling now. Thank you guys so much for your responses. We will go over the results at the end. Okay, so now, Ms. Arellano, I'm going to let you go ahead and take control of the meeting. I'm going to stop my screen share, and then you're welcome to go at your own pace for your presentation, however you see fit. So everyone, please give a warm welcome to Ms. Arellano, and let's look forward to her presentation.
Awesome. Thank you so much, everybody, for being here. I'm so excited to present to you all today. And thank you so much, Kenneth, and all of you for the introduction. So can you all see my screen just to confirm before I move a little further?
Yes.
Yes. Okay. Awesome. Thank you. Alrighty, everybody. So welcome. I'm so happy you're here. I understand how difficult it is becoming to just do regular things and learn new information when we're in the middle of a pandemic and it's chaos out there. So I truly, thank you for being here today. So today we are going to talk about interconception care and LARC. And so I'm Jennifer, I'm a health educator from Anthem Blue Cross. And prior to this, I actually used to teach comprehensive sexual education to our teenagers. And so I'm really excited to see, older adults or, people of all ages who also would love to see this information in regards to pregnancy. So I like to start presentations kind of breaking down words, because sometimes we hear things and we're like, what does that even mean, right? It's a huge word. And so when we talk about interconception, and there seems to be most of you that know and are aware of interconception care, is that this little portion of the word here means in between. And so I'll use my laser pointer. Inter, whenever you see inter, between. Conception is the act or the action of conceiving a child. For those of you that know Spanish, concepción usually means, of course, the process of becoming pregnant, in simple words. So when we talk about interconception care, we're really talking about the care that you need between each pregnancy, and why that is important, right? And so to show you all, I kind of just decided to do a bit of a visual, but as we see up here, interconception care equals or means care between pregnancies. So when we have a pregnancy, a first pregnancy, we usually have what we call at the beginning, before you even become pregnant, we call it preconception care. This is where before you're in become or even think or planning to become pregnant, you decide to do things that will improve your overall health. Maybe you want to get a little bit healthier before you become pregnant. You might want to do several steps to make sure that you have a healthy pregnancy, like dealing with any substance abuse issues or anything like that, right? And this is when you become pregnant, right? You have a successful pregnancy, and then you give birth. And then that is where interconception care kicks in, especially if you plan to have a second pregnancy. So interconception care is that care that happens between pregnancy number 1 and pregnancy number 2. And what this is doing and what this is focused on is your body healing, your body going from one pregnancy to the other in a very healthy way that will maximize or make your health and the baby's health better and have better birth outcomes. Then you'll probably hear, and it's pretty similar to postpartum care, and I'll explain kind of the relationship, but once you give birth, you do what we call postpartum care, which is where you go to your doctor, you go to your visits, and you take care of your body after the pregnancy happens, so that you again can continue to live your life. And I'll kind of point this out just pretty briefly. Why is it important? Giving birth is huge on the body. It's almost a trauma for the body and something pretty big that people go through. There are obvious complications, and it's super important that we take care of ourselves after this period because it can lead to several health outcomes. And so some of you may have already heard of the term birth spacing or baby spacing. I think when I first heard it, I heard baby spacing and I was like, what is that? And then you hear interconception care, which is the more medical term. So when I talk about interconception care, we're also talking about birth spacing, baby spacing, and all of those things. So I'll go ahead and move on. And if you have any questions, of course, feel free to put them in the chat. Usually I kind of read them as I go. So this is what the recommendations are for interconception care. Basically, the main key thing, and I think a lot of you got this right, and I'm pretty sure it's a continuation of your knowledge, and we're just kind of building on that. But yes, waiting 18 plus months between each pregnancy is the recommendation. And like I said, giving birth, being pregnant takes a huge toll on your body. And it's really important to give your body the proper time to heal and to recover and to become stronger for the next pregnancy, so that not only you, but also the baby can have a better health outcomes. And I'll go into detail about those health outcomes in a second. But it applies to all women of reproductive ages who have been pregnant. And so reproductive ages is different for everybody, but it's anywhere from teenage years all the way up to menopause, basically. But it particularly applies to those who have been pregnant. Again, it is your body's way of preparing or recovering from pregnancy number 1, but also preparing for pregnancy number 2. It is a continuum for postpartum care. And so we want to make sure and this is our responsibility as health plans and as, medical professionals and all of that, is that we tie it in with that postpartum care and start talking about, what you want to do next. So some of you have probably gone to provider offices where they're asking you, well, you're probably like still pregnant and they're asking you about birth control. Do you plan on using birth control? Do you plan on having another child? And you're probably sitting there thinking like, why is this person asking me so many questions that I don't probably know the answer to yet? And the reason why they ask is because we want to make sure, again, that you're getting the care that your body needs and the recovery time that your body needs. And so I know sometimes they come off as a little, nosy and almost, and they ask so many questions, but it is for a reason. Some of the components here of interconception care, it's meant to be very, very comprehensive, very not just in regards to pregnancy, but also the managing of chronic conditions and other things that might affect your health overall. So we'll start with the components of interconception care. The first one is reproductive life planning. It sounds very fancy, but most of you have probably kind of done this without even thinking about it. And it's basically deciding when to have children, how many, and what steps are you going to take to make sure that your reproductive life plan happens as needed. And so birth control is a big one, which we'll talk about in a second, about reproductive life planning, because of course, there has been quite a bit of evidence that shows that, if you plan out this, your reproduction and you have a little more control over it, there is, of course, better health outcomes. So that is one of the components. So that's why they ask you kind of those questions where they're asking, well, do you plan to have another child? When? Because they're kind of trying to get you to think about those things and to start your own reproductive life planning. The next one is screening for depression. This is huge, especially now with, the world being how it is and just so chaotic and us being isolated as it is, but with, a pregnancy, of course, that further elevates those feelings of isolation. And so this is why it's really important in postpartum care, but also interconception care, that a provider screens you for depression as well, because of course that can have effects on your health and as well as the child's health and just the environment of the child's house in general. The next component is education about future health. And that is, again, why they ask so many questions, because as we all know, people sometimes experience complications in pregnancy, and we want to make sure that they get the appropriate, or you all get the appropriate, moms get the appropriate resources that they need to make sure that their future health is the best that it can be. The other component is managing chronic conditions. I mentioned earlier, or some of you may have already have experience with this, is that a lot of people do sometimes develop like gestational diabetes, for example, in their pregnancy and pretty early on in their pregnancy, and that actually makes them more likely to develop type 2 diabetes later in life when, pregnancy is over and probably the child's a little bit bigger. But it's important to manage those chronic conditions again before we continue and have another pregnancy. And then the last one, finally, there's a little bit more, but making plans for long-term medical care. Again, this is a pretty big component, and we just want to make sure that we're getting the care that we need, that our bodies fully recover, and that we can have another successful pregnancy, and then continue on with our health even after pregnancy. And so it does provide an opportunity, like I said, to optimize health, or to make our health way better and just overall great before we have another pregnancy. And so that's kind of the components of interconception care. And we'll kind of go over some of the, I believe, why it's important. So why is interconception care, or baby spacing and all of that, important? A few things. The first is that, and just to give you a little bit of statistics, is that 33% of pregnancies happen in less than 18 months after their previous birth. That was kind of a handful. But if we think about every 100 births, about 33 have their children before the 18 months, meaning that they probably have one pregnancy in January, they give birth in January, right? And then by, so many months, they're already pregnant, and it's usually under 18 months. I think some of you have siblings, right, that they're kind of back to back in years, and that is less than the 18 months that is recommended. And so that is a pretty large number. And why it's really important is for the next reason, is that appropriate birth spacing can reduce the risk for preterm birth and low birth weight. This is a pretty huge problem in our community, is that a lot of children are born prematurely, are born before the 37 weeks, and also are born with low birth weight. And so there is a little bit of evidence that shows that not waiting those 18 months can, of course, increase the chances of preterm birth and low birth weight. These tend to have, and some of you probably already know this, but when a preterm birth happens, or somebody is born, or a baby is born with low birth weight, which is what we call it, is that they're considered poor birth outcomes, and they're often associated with, and we see on the right over here, ongoing health problems. And so this means that the child is going to have several health problems, not just, in the few moments that they're born, but later on in life, such as developmental delays, asthma, vision, and hearing loss. There is also a lot of, when usually kids have such health problems at an early age, it can start to affect their academic skills, their academic performance, their social skills as well. And so we want to make sure that, and that is really why we want to advocate, and we want to strive to reach that interconception care and to plan out or baby space for at least 18 months or so. So those are just kind of why it's important. There are several other benefits to interconception care, and a lot of it has to do with, of course, the family dynamic and, of course, the future babies and the health. But for sure, the next one is that future babies will be healthier, of course, because mom's body has had enough time to replace nutrients, to replace or re-strengthen that immune system so that they're in tip-top health again, to be able to reproduce and have another healthy pregnancy with proper adequate spacing. And then another key point, like I said, it does start to affect the family dynamic in a positive way, is that children who are adequately spaced are better prepared to begin kindergarten and perform better in school. Like I said, this has to do more with the fact that they might have those developmental issues when because of the preterm birth and because of the low birth weight. And so we want to make sure, again, this is why when we're thinking about baby spacing, is that it has to do with health, but also academic performance and the long-term health and care of that baby who's going to grow on to become a child and then an adult. And then, of course, there is financial impact. It's really tough to have, children that close in age, because, there's a lot of costs that happen with babies, and especially when they're so close together. With the 18 months, it gives people time to, of course, plan out and less strain financially. There is also some evidence that suggests that, the baby spacing will allow more time for each child, so that you can, bond with each one properly, but, not that you can't when there's two spaced, but those are just kind of some of those stats on that and that information. So with that, I'm going to kind of transition over into baby spacing or LARC. And so a huge part of interconception care is what we call, access to family planning. So access to family planning, counseling, and contraception plays a key role in birth spacing and reduce risk. I'm sorry, that was like a tongue twister, for poor birth outcomes. Now, the key here, and one thing that's really important to know, is that access, it sounds really easy being like, oh, access to family planning, sure, right? But as it turns out, it is very challenging sometimes to get adequate, and that is actually one of the barriers in baby spacing and family planning and LARC, is that sometimes there aren't a lot of providers, or they're completely spaced out. And I'll talk about those in a second. Most contraceptives, most birth control are free or low cost with Medi-Cal, which is where we're at, or family pack services. I attached the card here because most of you have probably seen this, probably have one of your own, but these are all programs that allow you to get these services for free or low cost. And so if you have any questions about that, you can go ahead and ask your provider as far as cost goes, but for the most part, it should be covered under Medi-Cal or family pack. And so I'll kind of transition now over, we talked about interconception care. And so inter meant between, and we know what conception means. In Spanish, it's concepción, right? And contra, which again, for those of you that know Spanish, know that en contra means against, right? And so when you see the word contraception, contraceptives, those sorts of things, they basically are things or objects or, medication, that is against becoming pregnant. So what it does is it helps you not become pregnant. And so whenever you see, again, contraceptives, those sorts of words right there, that's kind of what they mean in more basic terms. We're talking about birth control. But that's kind of why they name it like that, Latin roots over here. And so I kind of want to backtrack a little bit as to how birth control works, because whenever you hear people talking about birth control and contraceptives, they always say, well, birth control helps prevent pregnancy. Birth control helps prevent pregnancy. But very few people actually tell you how and why, which leaves us with like, well, how does that even work? And so I'll kind of explain this briefly. And so the key point here is that hormonal birth control tells the ovaries not to release an egg. So what two things do we need to become pregnant? A sperm cell and an egg cell, right? If the egg cell is missing, that means that we cannot become pregnant, because we need both, right? We need the sperm cell, we need the egg cell. And we see down here that I put no egg equals no pregnancy. And so what these hormones do that are in the birth control, they tell our ovary friend over here not to release an egg. Like I said, if the egg is not released during ovulation, then a person will not become pregnant. So really interesting stuff. But yeah, the hormones kind of tell the ovaries, they kind of hold them hostage a little, and they tell them, hey, don't go outside, don't leave the ovary, and they won't, for the most part, okay? Birth control also works in several different ways. That is the main point, but a few of them, depending on the method you're using, might thicken the cervical mucus. So this is the cervix right here. This is the part where if you're pregnant and you're in labor, this is what they're looking for dilation, right? When they're like, oh, she's 10 centimeters dilated. This is the cervix. And so the cervix here has what we call cervical mucus, which is basically fluid. And what birth control does a lot of the times is that it increases this cervical mucus. It makes it very, very, very thick, so that when sperm comes up this way, it kind of has to, it finds it very, very difficult to kind of get through that cervix. So I always describe it as snow. So if you've ever been, driving or even walking in snow, it's very, very challenging to get through snow. And so that's kind of what happens with the sperm cells. And so that's kind of what it does. Other things that it does too is that it thins or keeps, this is the endometrium, which we see here. It makes that very, very thin to make sure that implantation does not happen. So when an egg is released and it does meet a sperm cell, the sperm cell becomes fertilized, and then it sticks itself right here, and that's what's called implantation. So what a lot of these birth control methods do is they also keep that lining thin, because if the lining is thin, it makes it really hard for people to become pregnant as well. And so that is kind of what birth control does. Very interesting stuff. There is one exception to that, and I'll go over it in a second. But there is a non-hormonal method that is a little bit interesting, and we'll go over that in a second. So birth control, there are so many types, and I'm so excited to share to share all the different types. There's so many, it's really confusing sometimes, but basically we're going to start up here. We've been talking about LARC methods, and so I'll kind of go into what exactly LARC means right now. And so your LARC methods are these that are up here. And so the way this chart works is that anything on this top tier right here works really, really well. We see up here that it's 5 stars, excellent. And if we look at what is your chance of getting pregnant, less than 1 in 100 women will become pregnant. So can a person still become pregnant from our LARC methods? Yes, they can. The chances are very low, but there is always a chance that a person can become pregnant. The ones that are in the middle, and these are what we call the non-LARC methods. So I think there was a question on there. The non-LARC methods, they are still birth control methods, but they are a little bit different. And what I want to point out is that what makes them non-LARC is the amount of time. So the ones that are here are 3 stars, so they work pretty well. But about 6 and 9 women, you have a bit more of a chance to become pregnant with these. These are more like 90, 92, right? They could go anywhere from 92% to 99%. They can be very effective, but there is still a chance that you can also become pregnant. The amount of time is what makes these two the most different, right? And so here you have methods that you might have to take every single day, like the pill. The patch you change every week, the ring every month, the depot shot every 3 months. It requires an action by the user. That is what makes it really likely that a person may become pregnant, which some people, you always hear stories, right, about, oh, I forgot one pill that one day, and that was the time that I became pregnant. And yes, it requires an action by the user. The reason why these do not work as well as these is because we are human. We make human errors. And there are times, like I said, with the pill that we forget, this, we forget that. And so that is something that contributes to that, of course, room for error. As opposed to the LARC methods, they are inserted one time for various years, which is why they're so effective. Again, why is it 99% effective and not 100% effective is because the people who create these are also human, and we have limitations of our own as well. But overall, pretty good. The condom, I have to disagree that it does not, it can be up here, but of course, we want to make sure that people know how to use them. I want to point out that these right here, our middle shelf and our top shelf birth control can be very effective in preventing pregnancy. However, it does not protect you against STIs, which some of those STIs can be passed along to babies once they're born. Okay, so I'm going to move on. These are all methods that we don't recommend. Of course, we have withdrawal, fertility awareness. That would be another lesson. I'll go ahead and move it along for the sake of time. So I kind of want to break down what LARC means, and I should have started there. But basically, LARC stands for long acting. So there's our L and our A. Reversible are contraceptives. Long-acting reversible contraceptives. So when we hear about LARC methods, LARC, that's what we're talking about. Long-acting reversible contraceptives. So what does that mean? Long-acting means that it offers pregnancy protection for years. So if you looked at those these are the LARC ones, right? They go anywhere from 3 years to, in this case, 12 years for the Paragard. And the Paragard's real special. We're going to talk about Paragard in a second. This one offers pregnancy. Again, that's what it means by long acting. Why are the pill, the patch, the ring, and the shot not LARC methods, it's because they are not long acting in the sense that they don't protect you for pregnancy for that long. So I'm going to pick on the pill, for example. Pill is not a LARC method because if you miss a pill, can you become pregnant? And you can answer this in your head. The answer is yes. And so it's not like you take one pill and you're set for the rest of the year, right? If only it were that easy. So that is what we mean by long acting. Reversible means that you can still become pregnant after using. I'm going to go back and forth a little bit. I know some people are like, whoa, why do that? Sterilization, I know they put it up here and it's not a LARC method, which I want to point out. It's not a LARC method, but this is a method that that is not reversible in some cases, and that's why this is not considered a LARC. So with reversible means that you can still become pregnant after using. So say you were on the implant or IUD, after you take out that implant or IUD, you can resume with, pregnancy, and you can still continue to have children. And last, we kind of went over what contraceptives are, which are birth control methods, meaning contra is against pregnancy. Contraceptives are any birth control. So we have our implant, the condom, the pill, the patch, all of them. So they're all birth control methods, but only few are LARC, okay? In general, LARC methods, and what makes them so special is that they require a one-time action or insertion, and they prevent pregnancy for an extended period of time, okay? And so that's kind of what we mean by these methods is that, and I'll go into a little bit more detail right now. So there are only two kinds of LARC. We have our hormonal implant, which most of you have probably seen the commercials. It's Nexplanon. That is the most important or the most popular. I don't think there's another brand here in the US that is the implant, but it's this tiny little stick that looks like a match. It's about a match size, and it gets placed in the arm. And so in the arm, it is placed. This little stick right here is full of hormones, and what they do is they slowly release hormones into our body, into our bloodstream, and then remember, they tell the ovaries to not release an egg. And it does this for 3 up to 5 years. So I know on the commercials, I think it says 3 years, and on the thing it said 3 years as well. But there is a lot of evidence. Now I think Planned Parenthood is making them to where they last 5 years. If you do get one, you want to make sure you know when, and they'll give you a little card that tells you when it's time to remove it. Now, I did mention that you can keep this for 3 to 5 years. Now I'll ask you all a question. Can you take it off or out before that? And the answer is yes. You absolutely can. Just because it says that it's 3 to 5 years, it does not mean you have to commit to it for that long. You can get it removed sooner, and a lot of people do get it removed sooner because they want to become pregnant or for any other reason. This requires a special team to do it, and I'll get to that in a second because that is one of the barriers, okay? The last one, or the second other type of LARC, is the intrauterine device, okay? Intra, I know it sounds scary. Intra means inside. Uterine means in the uterus. So it goes inside the uterus, and I want to show you all a picture so that you can all kind of understand. This down here is the vaginal canal, the cervix, and then the IUD actually goes in this area right here, inside the uterus. This also, again, requires a medical professional to insert it, and there's 2 types. There's a hormonal and a non-hormonal one, and I'll go into detail about that in a second as well. I'm almost done, I promise everybody, but really quick, these 2, the reason why and one of the barriers to accessing this is that very few people can actually insert one of these. This cannot be like a nurse or, an MA. They have to have some sort of license. So it has to be, I believe, like a physician assistant and an MD that inserts these, because it's a mini procedure, right? With a hormonal implant, you get numbed in the arm, and then they insert it. And then with the IUD, they insert it vaginally, which of course that also does require somebody with a lot of experience. And this one is a little bit easier to get. The IUD has a little bit more of a special, I believe, certification and a provider who is willing to insert these. So there are two types of IUDs. There is a hormonal and a non-hormonal one. And I want to go back to show you all because you've probably seen these commercials. Is that there's the Skyla, there's the Mirena. These are the ones that are hormones. They're telling your body not to release an egg. But Miss Paragard over here is very special. They are made out of copper, and it lasts, or it can prevent from pregnancy for 12 years. It could be inside the uterus and prevent against pregnancy for 12 years, which is incredible. How it does that, copper repels sperm. It's the best way I can describe it. And so what it does is it does nothing to your body. It actually repels sperm, and it tells it, it makes it make a U-turn, and that's how that birth control method works. Very effective, 99% effective. And so it is a great, great option for people who do not want to use a hormonal birth control method. Again, this is very great. Do you have to keep it on for the 12 years? No, absolutely not. You can take it off sooner. And it's very recommended, of course. Another thing that I kind of wanted to point out is that with the IUD in particular, and this is something that I learned a couple of years ago just with some friends, was that after you give birth, the providers try to push this on you quite a bit. Apparently they become a little pushy about it. And so why they do that, it's because, sorry, I have to keep going back and forth. I hope it's not distracting. But when you have just become given birth, what happens is that the cervix here is slightly open, and it remains open for a couple of days. And so that makes it really easy for the provider to go in and insert it without feeling some sort of discomfort. So that is why they want to do that right away. Do you have to? No, absolutely not. And it's important that you all know that you can say no to these things at that moment. So what are the side effects of LARC? So just like pregnancy, the use of LARC feels very different to everybody. I think you've all probably been in conversations where you talk about your pregnancy and your pregnancy experiences, and one will be like, oh, I gained so much weight, and the other's like, oh, I barely gained any weight, or I had so much nausea, and then another person's like, oh, I had no nausea, I had a great pregnancy, right? It is important to know that LARC affects everybody very different. So some people with the implant are like, one of the biggest things that you'll hear is that they gained weight, and it kind of is about 50-50. Yes, it is possible for people to gain weight on that. It has to do with the hormone. The hormone sometimes has that effect on people. However, it does not happen to everyone. Some of the other symptoms are irregular periods. For about the first 6 to 12 months, you just introduce something new to your body, and it's going to take it a while to kind of readjust. The second one is some more temporary ones are headaches, sore breasts, and mood changes. Again, you just introduce something new to your body, and it's taking some time to adjust. And less common, some people get acne, nausea, or some might experience weight gain, like I said earlier. The IUD symptoms, and this is for the hormonal ones. So irregular bleeding for the first 3 to 5 months. And then it may cause slight increase in vaginal dryness, flushing, headaches, nausea, and acne. These are pretty rare, and again, they may happen to you, they may not. It's really important to just understand the side effects and just understand that they also don't happen to everyone, and you should never let somebody else's experience kind of, talk you out, because no two bodies are alike. You can try these things yourself, and you can have them removed, whenever you need to. You may feel some discomfort at the time of insertion. So with like the implant, they inject you. It's like when you go to the dentist, they numb you before they're going to do all the stuff, and even the numbing hurts a little. And so that's kind of what it is. But for some people, they would rather, feel these symptoms. or these symptoms are pretty minimal, then going through another pregnancy again or a pregnancy sooner, okay? When deciding what birth control method is best for you, here are some things that you want to think about. The first one is, of course, the question I've asked, do you want to have children? If so, how many, how soon, how spaced out? Do you have any health conditions? Some birth control methods may not work depending on what health conditions you have. How often do you have sex? How do you also need protection against HIV and other STDs? How well does a birth control method work? Are there any side effects? Are you okay with the side effects? Some people with the weight gain, that throws, they're like, I don't want to risk it. If you're okay with that, then that would be one to consider. Will you be able to use it correctly every time? This is a big one. And do you want to have a menstrual cycle? So I'm going to go back to this chart. This one right here, the pill, is very, very notorious for causing pregnancies. And I'll have to ask people, usually I ask people, are you forgetful? Do you forget things? If you're forgetful, if you have a crazy life, this method might not be the best for you, and that's okay. There's other ones that still have the same effects, but are lower maintenance, like the ring, right? Some of these methods also do not give you a period, which makes it really, really great for some people. However, some people might still want to have a period. So the ring usually lightens your period, and the shot also sometimes lightens your period as well. The IUD sometimes, the implant sometimes completely takes away the menstrual cycle as well. So those are also some things to consider. If you do not want to have a period and you want to use the pill, for example, it's also possible. You just have to tell your doctor, hey, I want a pill, but I want one that does not give me a period, or vice versa. You want to keep your period. And I think that's usually what they ask you. And so that's pretty much it. I know I think I finished just in time. I want to give some time for the exit poll and any questions. I want to go ahead and leave you all with some resources on how to get information on your own. Planned Parenthood, great resource. And Bedsider is where I got that chart from. There's quizzes that you can take that help you choose a birth control method that is the best for you. And then to find a provider to insert or to use one of those birth control methods, you can go on the Family Pact website. One thing I want to mention is that sometimes you'll run into situations where your provider does not have somebody that can insert the implant or the IUD. There are other places you can go to where you can achieve that. And you always want to call them ahead of time, because you can't just walk in. Unfortunately, with those two in particular, you can't just walk in and say, hey, I want an implant today. Just because it requires a very particular person to do this, and they need to make sure that that person is going to be in at that time, which, like I said, is usually a nurse practitioner, or I think a physician assistant, or of course an MD. And so that is pretty much it. If you all have any questions, please feel free to ask me them out loud or in the chat. And that is all I have for today. Thank you so much. Alrighty. Any questions?
Anyone have any questions? This is the time to learn.
No, I don't have anything.
Okay, well, everyone, I hope you all learned a lot. I certainly did. Thank you so much for that presentation, Ms. Arellano. Like she said, you can contact her at her email address at the bottom, jennifer.arellano2@anthem.com. Definitely go ahead and ask. She's a very, very insightful resource. And if you have any questions, definitely go and reach out to her. I really want to thank you guys all for attending. And so right now, as we conclude, like she said, she wanted to leave a little bit of time to the exit poll and everything like that. So Ms. Arellano, I'm going to take control of the screen sharing. That's okay with you. And but like she said, definitely, like, if you feeling kind of nervous about speaking up, if you have any questions, definitely go and ask. We're all
Well, this is Janice Mathrin from West Fresno Family Resource Center. Jennifer, thank you so much for accepting our invitation to present such a great resourceful, on a very resourceful topic, particularly as we are providing education on maternal and infant health. I learned a lot. I thought I knew a lot, but I certainly learned a lot. And so thanks for providing those options and making this great resource and educational piece available. I know you will be presenting another topic or similar topic, because we also have a Hispanic population, a monolingual Hispanic population that will benefit from this topic as well. And I think we have one scheduled for the 24th, I believe, coming up.
Yes, I believe
Okay.
so. Yes.
Awesome. So if any of you are on this webinar today and you want to share this information with others, perhaps you may have, I think there are some providers on, CBOs on this webinar. If you have clients you'd like to share their information with, please share and make sure that they sign up. And you can call our office and we'd be more than happy to provide the information, the link, and so forth. Okay, great. So Kenneth, we have a couple of, or you have the post test that you're gonna put up, right? The poll?
Yes, I do.
Okay.
Okay, one moment as I pull it up.
Okay, cool.
Okay, can everyone see the post-test slide right there?
Yeah.
Yes.
Okay, fantastic, great.
Yes.
I'm going to launch the poll, and then everyone go ahead and please go ahead and answer, and we'll review the answers.
There's no test popping up. Okay, there it
There
goes.
it is. There it is. Okay.
I can't see the test.
It may just be something to do, especially if you're on your phone. We've noticed that a lot of issues pop up if you happen to be on a phone. But
Okay, so I can
All it says is post
okay,
Sorry.
I can read the questions for anyone who's on the phone. So the first question is, how much time should you wait to have another baby? So there's option 1, 12 months, option 2, 18 months, and option 3, 8+ months.
Do I write it in the chat?
So, just, yeah.
It was 18 months,
I
right?
guess the best way you can. So you can write it in the
Should I
chat.
answer it on here?
Yeah.
Or just write it in the chat?
Yeah, go ahead and write it in the chat. So, question
Excuse
number.
me. What if we already took the test? Do we have to redo it again?
Yeah, so there's a pre-test before the presentation, and the post-test, it allows you to see if you've improved your knowledge. So it's the same test. So question number 2 is, what are long-acting reversible contraceptive? So the first choice is irreversible birth control that provides short-lasting pregnancy prevention, commonly used among women 15 to 44 years old. That's option 1. And the second option is reversible birth control that provides long-lasting pregnancy prevention, commonly used among women 15 to 45. So for that one, you can say either A or B. Okay, so question number 3. What are the different types of LARC? 1 is hormonal IUD, 2, non-hormonal IUDs, 3, implants, 4, all of the above. And the final question is, no, actually we have 2. True or false? Interconception care means care between pregnancy. True or false? And then the last question.
Say that one more time, please.
So, true or false? Interconception care means care between pregnancies. Is that a true statement or a false statement? And then the last one, it's also true and false. The pill, the patch, the ring, and the depot shot are also considered LARC methods. True or false? So did everyone have a chance to complete their tests?
Yeah.
Okay. So Kenneth, how are we doing?
We have 9 out of 11 participants.
Okay.
However, if you'd like, we could just go over the answers.
Okay, so yeah, let's go over the answer, and perhaps Jennifer, you can, talk a little bit more about it. Okay.
Yes.
So let's see what their results are.
So I'm going to end the polling, and so everyone can just see how everyone was doing.
Okay.
Right here, the orange just means I believe it's the predominantly chosen answer, but I will go
Okay.
I will answer it for you. So number 1, how much time should you wait to have another baby? The answer is yes, 18 and more months. So 78% of you have chosen the correct answer. So you should be 18 plus months. Secondly, what are the long-acting reversible contraceptive LARC methods? And the answer is reversible birth control. Reversible birth control that provides long-lasting pregnancy prevention, commonly used among men 15 to 44 years old. And the key word is reversible, like Ms. Arellano said. You have to be stuck with these LARCs. You can, once you decide you are ready to have a child, or you definitely can have the procedure retracted, maybe not retracted, but undone. You can definitely
Yes.
you have it undone.
Yeah.
And then the third question, what are the different types of LARC?
So can you pull it up on the, scroll it up a bit so we can see the results for questions 3 to 5.
I still can't see anything.
It might just be your phone.
My phone? Okay.
No. I mean, like, I was speaking to
Okay, I
the
see. Okay.
Number 3, what are the different types of LARC? So you have hormonal IUDs, non-hormonal IUDs, implants, or all of the above. The correct answer is all of the above, with 89% of participants responding in this manner. And finally, true or false, oh, sorry, I believe there's 2 more actually. True or false, interconception care means care between pregnancies. And that is true, with 78% of participants answering in this manner. And
what was number 2? Hello?
Hello?
Yeah, what was the answer to number 2?
The answer to number 2 was, it was reversible birth control.
So it's
Did you
B,
see?
the second option.
Yeah, the second option. Okay.
Thank you for the knowledge.
Okay.
Of course.
And then finally, number 5, true or false, the pill, the patch, the ring, and the depot shot are considered LARC methods. The answer, with actually, contrary to the polling results, is only 44% of participants got it, with 56% of participants answering.
Oh, wow. Okay.
Yeah.
The answer is false. And Miss Arellano, actually, I thought it was true too. So Miss Arellano,
Yeah, they are still birth control.
Hey, I was listening. I
Yes.
think false too.
Yeah, it was a tough question. It was a tough question, but basically they are still birth control methods, but they're not officially LARC because the pill, the patch, the ring, basically if you stop taking them, you can become pregnant like right away. And so with the difference is that with the LARC methods, they stay in your body for a couple of years. With the pill, if you forget one pill, it can make you pregnant. And you have sex during that time period, it can make you pregnant. So yeah, but most of you did. It's a hard subject. You know, I know it because, you know, I've been saying it for a long time, but, and one thing that I forgot to mention in the presentation is that there is no age requirement for these birth control methods. So sometimes providers, and this is one thing that we experience a lot, they try to kind of discourage you, which is unfortunate, but there is legally no age requirement to getting any of these birth control methods. So young women can also receive those methods, all of them.
Awesome.
no, good to know.
Right.
So
Thank
can everyone
you.
still see? I'm gonna close the polling, and can everyone still see that post-test progress page?
Yes.
Okay, fantastic. We're gonna move.
Yes, I can see it.
Okay, so hooray! It's time for a gift. Hold on, I'm gonna. Okay, so today, thank you all for coming. We're going to have a giveaway, yay! And then, yay! And so we're going to be hosting a little giveaway really quick, and we're going to show you your prizes. So this is what's up for grabs today. If everyone can see, let me know if you can see.
Yes, we can see it.
Fantastic. Okay, so everyone, if you guys can go ahead and see, look on the left, we have 2 face masks and a $5 gift card to Starbucks. And on the right side, you have a $10 gift card to Walmart and 4 face masks. So who is excited?
I am.
Great, fantastic. Okay, so I'm gonna go ahead and share.
I bet you is, Mom.
All right.
What was that?
I was talking to my mom because she won last time.
Okay. So we have,
She's a hater.
okay.
Okay, everyone. So I'm gonna share my screen right now, and you guys are gonna see a wheel.
So Lupe Rosales, was that person the person that joined?
Lupe Rosales. I do not have Lupe Rosales in this.
Okay. Okay, she said she joined late. Okay.
Ms. Rosales, you might have been the person who joined about like 10 minutes ago. Is that correct?
Okay, so Ms. Rosales.
No, that was me.
That was you. Who was that?
Caitlin.
Caitlin. Okay, so Caitlin, what we'll do is we'll give the people who were here.
Yeah, for sure.
Yeah, and so we'll connect with you again. Okay.
Yeah, no worries.
And Janice and Kenneth, I'm with Jennifer, so you don't need to.
Okay. Yeah. Okay. I don't think. Okay. Yeah. Truk. So he doesn't. So Kenneth, you don't need to include Truk's name. Okay. Or if she wins, she can give it out.
Spin it again.
Spin it again. Okay. Okay. Okay.
Good luck, ladies.
Yes. Good luck.
Can everyone see this list? Everyone see it?
Yeah. Yes. Okay.
As it is right now, this is who I believe has received participation for being here, minus Caitlin Chavez, who just took herself out of the running for this one. But she did give her credit for being here as well.
Yeah.
Don't worry too much about that.
Okay. Let's go. Spin it.
Okay. Good luck, everyone.
Celia Ochoa? Celia Ochoa?
It almost was awesome. It was
Yay, I'm here.
Okay.
number
Celia,
one.
did you win last time?
No, this is my first time.
Okay. Well, congratulations.
Congratulations.
Thank
So you get a $5 Starbucks card and a couple of cloth face masks.
Thank you.
Ms. Ochoa, if you could go ahead and send me a private message with your phone number so we can contact you when you can come and pick up the prize as well. And so
Okay.
in the meantime, we're going to do the second one.
Okay.
So, all right, everyone. There you go. One less person, which means higher chances for everyone else. Okay. Ready and go.
Okay. So let's do it again. No, Daniel, let's try one more time.
Miss Tang,
You
I'm sorry.
come. Yeah.
Okay, all right. Well, I'm going to remove you and we're going to see who wins, okay?
Dominion, congratulations. Dominion Omagwawi.
Oh, Margaret, thank you.
Okay, congratulations. So you
Thank
win a $10 Walmart card and 4 face masks.
Thank you.
You're
Thank you,
welcome.
guys.
If you
You're
could
very
send
welcome.
a private message with the information, the phone number, please.
Okay.
Okay, great.
Need that. Okay, great. And so now we're going to just conclude the presentation really quick with the final couple slides that we had. And then we will let you dismiss. Okay, can everyone, what does everyone see?
Presentation begins. So
Okay.
take it down.
Yeah.
Can everyone see the prizes now?
Yeah.
Yeah.
So going to the next slide. So what is our next session? Our next session is what is a doula, the benefits of a doula, which is a panel discussion which will occur on December 3rd from 6 to 7. And then like we have our contact information up above, it's West Fresno Family Resource Center with our phone number being 559-374-5750. And our contact email frame fresnogrowsbbc@gmail.com. So if anyone has any questions or concerns, and if you won, go ahead and jot down that number. Go ahead and make us sure that you get us a call tomorrow. Make sure that we got you down, but just in the off chance, take that phone number down, and you know, we'll get you sorted out. And then I believe I still need Miss Dominion's phone number. But other than that, I got you down, Miss Ochoa. And then so we'll go to the next slide really quick. So we just wanted to let you all know that we have Spanish sessions as well. That if you happen to be a bilingual speaker or you know anyone who only speaks Spanish, we have the same type of information present for Spanish speakers with our next presentation occurring on November 24th, which is going to be the spacement for this one as well. It's going to be the same presentation, but occurring on the 24th, which is next week. So if you happen to know anyone who would like to attend and get credit for their mommy packs as well, it'll be from 11 to 12 morning. And we have some announcements which Miss Janice is going to cover.
Okay, so this is an announcement. There is the African American Coalition in partnership with our agency, West Fresno Family Resource Center. We have isolation and quarantine support funds that's now available to assist African American families. There are other community-based organizations that are serving, you know, Hispanic and other cultural groups. So it's not exclusively for African Americans. There are others. This support helps, you know, families with things like rent and food and utility assistance and other related expenses. So how do you qualify if you're experiencing financial hardship as a result of the direct impact of COVID-19? Going back, you know, all the way to October 1st, If you tested positive for COVID-19, or you were in close contact with an affected person requiring you to quarantine. In fact, this afternoon we had someone called in. He was not tested positive, but at his employment, one of their staff people actually tested positive, and he was in close contact with this individual, even though he tested negative, but he was quarantined from work for 14 days, which means, he was not able to get a paycheck. And so we did instruct him to get documented information from his employer to indicate that that was the case. And so there is a, screening process that takes place. So
Can you help him? But you help him now. You can't just leave him like that.
okay. Hello?
Sorry.
So, so if you know of someone or if you or your family is impacted, so feel free to give us a call at West Fresno Family Resource Center. And these funds are made possible through the CARES Fund, the CARES Act Fund. And that's it. Any questions? Okay. Well, thank you everyone for your participation, and we look forward to seeing you the next session. The next English session is December 3rd, and we'll have a panel discussion on doula option. It's a birth-in option, and I hope that you will be here. Thanks again. Thank you, Jennifer and Truk from Anthem Blue Cross for making it possible for us for this educational session. Take care, everyone. Have a good evening.
Bye. Thank you.
Okay,
Have a good
bye-bye.
night.
Thank you. You guys have a blessed night.
Okay,
Thank you.
Good night.
Thank
Be blessed.
you.
thank you.
Hey, Kenneth, I have to log off, but if you have any questions about what USC and all of that, I'll send you an email. I believe I have your email and we can connect.
Yeah, for sure. Sounds good. Yeah, go ahead.
Alrighty. Thank you. Bye.
Have a great day. Bye-bye. Hey, Ms. Carter, is there anything else I can help with you today? Ms. Carter?